Welcome, everyone. My name is Meg Weckstein, and I am the Senior Product Development Analyst for GetWellNetwork. And I thank you for taking the time out of your busy day to join us for today's webinar, GetWellNetwork Newest Product Innovation Update. Our goal for today is to introduce you to the new features and functionality available in our new release of GetWellNetwork PLS versions 5.2.5 and 5.3. Before we dive into the presentation, I'd like to go over a few details that will help everyone get the most out of this webinar. First, today's webinar is a live presentation with a Q&A at the end. Attendees were automatically muted when you joined the webinar. Please leave yourself on mute to cut down on interruptions. However, you can absolutely still participate. On the right-hand side of your screen, you should see a chat box. Use that to submit any questions you have. If the chat box gets covered up during the presentation or for some reason you can't see it, move your cursor to the top of the screen and select Chat from the top menu. Also, after today's webinar, when the WebEx session closes, you will be asked to complete a short 3-question survey regarding this session. Your feedback is important to us so that we can make sure you get the most out of these webinars and we can follow up with any additional information material as needed. Now, let's go ahead and dig into our presentation. Before we jump into features and functionality, I wanted to take a minute to talk about GetWellNetwork's new adoption of the rapid release software development philosophy. Those of you who've been with GetWellNetwork for some years may have noticed that we've put out our last few updates on a shorter timeline than before. All of this is due to our adoption of the rapid release philosophy of software development. Now, rapid release doesn't mean that you develop anything too quickly or that you skip steps in the development process or that you develop under any artificially short timelines. Rapid release just allows us to deliver quality features to clients quickly while also mitigating risk. Getting smaller bundles of features out to clients more quickly gives us the ability to release features as they're developed, instead of delaying small features as they wait to be bundled with larger ones. Similarly, we can release large features in milestones, getting the first versions of a feature out to clients sooner and immediately beginning to get feedback for later versions. Smaller builds also mean less code change at any one time, so less for our testers to test during the QA process, and that leads to smaller risks. More smaller releases not only mean that we get new features into your hands more quickly to help begin driving patient satisfaction and clinical outcomes immediately, but also that each release is in and of itself more stable. We're really excited about this move and look forward to getting great new releases out to you at least once every quarter, if not more often than that. On our agenda for today, we're going to go through 2 all-new features now available to the GetWellNetwork client base, as well as a number of exciting enhancements to existing features and functionality. Just a note for all of our government clients on the phone. All features and functionality we talk about today are available to government clients except for video conferencing and smart TV, as those are add-on technological packages that still need to go through the government technological vetting process. Those features will be the first that we go through, and once we're done with those, everything on the phone will apply to you equally. So the 2 new features that we're going to talk about today are GetWellNetwork on Smart TV and video conferencing. And the rest of our release is going to focus on enhancements to really high-value features that we have in the field today already. There are the asynchronous patient history trail report, a bulk create for whiteboard patient goals, iPad ADT check-in and improved device registration, an updated outcomes achievement plan, the ability to prescribe cross-continuum pathways, and updated HTML5 games and prompts. Let's start with our new features. Those of you who have attended any GetWellNetwork product presentations in the last 6 months have almost certainly heard us talk about the amazing and innovative work we're doing to leverage smart TV technology for interactive patient care. We are so passionate about smart TV development because smart TVs represent the future of delivering IPC to inpatient rooms faster, cheaper, and in the most supportable way possible. In short, smart TV represents 4 big wins for clients and hospitals. 1, it lowers total cost of ownership. The cost of one GetWellNetwork-enabled smart TV is much lower than the cost of a traditional TV monitor, PLC, IMX, tuner, and all of the cables that accompany a traditional in-room deployment. Total smart TV deployments consist of just 4 cables accompanying the TV. a power cable, an Ethernet cable, a pillow speaker cable, and a coax cable. They also eliminate the need for an IMX box. By eliminating hardware, we eliminate potential points of failure. And that ease of installation and maintenance are really great both for clients and for GetWell Network. Less hardware means less to install, less to maintain, which is both less effort and less cost for everyone involved. Second big benefit to smart TVs, to GetWell Network on the smart TV, is that the patient experience can overlay on external devices like Xboxes, DVD players, anything else you're plugging into your TV in the hospital environment today. This allows us to extend the interactive patient care environment to places we've never been able to go before, to pull patients back into their education when necessary. Third, smart TVs provide a better TV picture than a cheap USB tuner is able to do in a majority of environments. And then fourth, and this is really cool, there is the ability to use smart TVs as mobile hotspots in the future. We know that's something that is high on the agenda of a lot of our hospital IT departments. We're really excited about being able to bring that into hospital environments. The next innovative feature that we want to talk about is GetWell Network video conferencing. And I get asked a lot about why we've invested the time and effort we have in video conferencing in hospital rooms. And I think that this is one of the greatest breakthroughs that we've been able to make recently in allowing patients to connect with the world outside of their hospital room, but still do it in a secure and sustainable technological way. And that's all thanks to our partnership with Video Incorporated. Video's integration provides patients with a single, streamlined video chat experience. And they can use that video chat experience to do a lot of high-value things. For instance, using the streamlined experience, video conferencing allows physicians to video conference directly into patient rooms. That gives physicians at a lot of our regional hospitals a streamlined process for accessing a lot of patients without having to drive across the state to get there. Video conferencing means that physicians can spend more time engaging with actual patients and less time worrying about how they're going to see their entire patient load throughout a diverse geographical location. Secondly, patients can also use video chat to chat with friends and family who may not be able to visit but who want to and need to provide virtual emotional support. Patients can also conference in remote caregivers like children and spouses during important rounds and consultations with doctors, physical therapists, and case managers, and other vital members of their care team. So as a recap, through video conferencing, patients can have remote consultations with doctors who might be serving patients in 3 or more regional hospitals at any given time, connect with friends and family who can't visit in person but who want to provide emotional support in any way they can, and conference in remote caregivers like spouses and children during physician rounds. We think it's vitally important to provide this service through GetWell Network to provide patients with a single, streamlined, interactive patient experience. And our partnership with Video Incorporated allows for the most secure, sustainable video conferencing connection possible. Now we're going to move into feature enhancements. These last 2 releases have focused on making sure that while we get valuable new innovation out into the world, we also continue to increase the value and functionality of some of our most highly utilized features based directly on feedback from our clients. The first enhancement that we've made addresses the fact that in today's big data world, we know that clients are constantly being asked to dissect their usage of data in new ways. The updated and improved asynchronous patient history trail report provides them with a tool to access that data easily and manipulate it as necessary. The report itself allows users to select data which is most relevant to them and then notifies users when the report is completed. The report results are delivered in a CSV as default, since we know that the majority of our client community needs this raw data in order to do the analysis that is most important to them. In addition, a report filled with raw data allows clients and GetWell Network staff alike to be agile and respond quickly to requests for new types of data manipulation without having to wait for a custom report request to be evaluated and built. Our next solution helps increase the value of the Interactive Patient Care Whiteboard. The Interactive Patient Whiteboard provides a wonderful way for patients and their care teams to keep patients' goals for their hospital stay at the center of each patient's experience. Our initial design allowed clinicians to enter each patient's individual goals to accommodate their specific health plan. However, we realized that some goals apply to multiple patients on one clinician's roster at a time, And at that point, entering the goal individually for each patient is inefficient. Thus, the bulk Create Patient Whiteboard Goals feature was born. This feature allows clinicians to select multiple patients and to apply a single goal to all of their whiteboard goals lists. This feature is built into the My Patients tab of the Management Console to make that bulk goal assigning as easy as possible for clinicians. And to show you how this feature works, I actually want to do a really quick demonstration. So I'm going to pull out of the PowerPoint here, and I'm going to open up a tab of Management Console. So you'll see that we are in the Management Console here. And this is a live Management Console in one of our quality assurance servers here. So this is live Management Console, but all of these are guest patients from an internal GetWell Network quality assurance server. So this is after I've searched for my patient load. I can select specific patients, or I can check this box that says check for bulk actions if I had previously selected only the patients that I knew that these goals applied for. I then go to this Patient Bulk Actions drop-down menu and simply select Create Whiteboard Goal. I can select from any of my hospital standard goals, or I can enter in specific goal text for these patients. So if I were a respiratory therapist who knew that I needed to get a similar goal out to all of my patients, I could simply type in here, use incentive barometer every hour. And that would go to all of the patients that I selected. I can also unselect patients here if I need to. Or could go to all whiteboards if this applied to all patients with whiteboard. Also, if I knew that there was a patient that wasn't on this list, I could search for them by first and last name. I then save, and that goal has been successfully saved. It's now on all of my patient whiteboards. So just trying to make that as easy and quick as possible for all of our clinicians. All right. So now we're going to jump into our next feature, which also simplifies processes for hospital staff, but this time with an eye to simplifying our IT processes. The next few enhancements I want to talk to you about are all enhancements for GetWellNetwork's tablet-based solutions, both inpatient on iPad and ambulatory. First, as the number of clients who need to be able to deliver interactive patient care on the tablet grows, we realize that we have a need for a more streamlined process for taking those devices from out of the box to ready to be in the hands of our patients and our clinicians. And so cookie-based identification was born. Our cookie-based device identification is a streamlined process for device registration which allows for an easy process that doesn't sacrifice security. Upon installing any version of the GetWell Network mobile app, version 1.6 or higher, the app will automatically download a cookie, which allows the client to register the device by simply entering the appropriate client site ID and password. Once your content is configured and your licenses are in place, it is a simple four-step process to register your device. You simply first download the app, then open the app, and then enter in your site's ID and password, and then once you choose a location, your device is registered. There's no pre-certification setup needed. Our next innovation is another way to streamline these iPad deployments. Bed lists were traditionally another barrier to expanding GetWell Network ambulatory and inpatient mobile deployments as quickly and as effectively as clients needed. Following the upgrade to PLS 5.3 and mobile version 1.6, any location with a facility unit and room location can automatically expand to accommodate as many mobile deployments as necessary. Now, this is really great news for areas like NICUs or outpatient offices, which might want to add one or two inpatient mobile or ambulatory licenses to accommodate volume, but wouldn't want to be held up with coordinating a traditional bed list expansion when a bed list might not really apply to their care setting. And lastly, one of the greatest hurdles to our ambulatory and inpatient mobile deployments has long been a lack of any integration. Now, PLS 5.3 represents GetWell Network's ability to integrate inpatient mobile devices in with hospitals' existing ADT feeds, providing an opportunity to leverage existing orders, results, and medication education. This integration takes advantage of a patient check-in screen to authenticate that the correct patient is being placed in the device. Once the device is checked in, it can tap into the power of existing education orders and results integrations, as well as existing medication integrations. Since this represents such a breakthrough in the way hospitals can use our inpatient mobile solution, I actually have a special guest star in the room with me today, Mike Reynolds, who's the Director of Mobile Development, and he's here to demonstrate exactly how this integrated check-in process works today. So I am going to pass the presenter rights over to Mike, and he is going to show you what we've been talking about here.
One second here, I'm just going to share my screen. Alrighty. So as Mike mentioned, today I'm going to be showing our integrated patient check-in for our mobile tablet solution for delivering patient education. What you're seeing right now is our management console, and I'm going to search for a patient that is in this test system that was placed there from an ADT integration. Our patient today is Mr. Brad Pitt. And currently, this patient is not in any GetWellNetwork location, neither a hospital room with GetWellNetwork or an iPad. So I'm going to have to check this box here to say include non-GetWellNetwork location results. As you can see, we have one patient returned, our patient Brad Pitt. I'm going to bring up his patient profile. Currently, Brad is in the hospital, and the visit ID for his visit is 1234. And you can see that currently he has no education ordered. I'm going to go ahead and order a piece of education for Mr. Pitt here. And this simulates a patient getting ordered education through an order interface in the EMR prior to them being moved into a GetWellNetwork location. So I'm going to order the About Pain Management video. Go back to Brad's patient profile, and we'll see that we have one outstanding not started order for the About Pain Management video. And now I'm going to demonstrate the workflow around moving this patient into an iPad location using our integrated patient check-in workflow. So you should now be seeing my iPad, and this current state is basically the iPad with no patient checked into it. As you can see, most of the UI is grayed out, and we have this nice big check-in button. I'm going to tap that. Now, if you have iPads already at your hospital, you may be familiar with that check-in button, but this screen may look different. In our prior check-in workflow that worked with guest patients, you just entered the patient's first name, their preferred language, and then checked them into the iPad. And that was basically creating a placeholder patient so that the patient could interact with our system, but it meant nothing was getting documented back to the actual patient's patient record in GetWellNetwork and in the EMR. So now we have more fields that to be filled out when checking in a patient, and that's so we can positively identify a single patient to be moved into this iPad location. So the account number is the same as the visit number, and we saw for Mr. Pitt that number was 1234. We do want to type in their first name correctly, and we'll need their date of birth. Now, this information is used to corroborate the account number that was typed in. So basically, this ensures that whoever is checking in the patient to this location knows enough information about them that they're authorized to be placing this patient record into this location. So we have the account number, the patient's first name, last name, and date of birth, and all 4 fields are required. Mr. Pitt speaks English, so I'm going to go ahead and tap the check-in button. And you can see now that the patient presentation is saying, "Welcome, Brad," which indicates that we actually have the patient record moved to this location. And you'll notice under the watch videos picked just for me, patient priority or to-do list item, that there's already a 1. That represents that outstanding order that we placed earlier. And there it is, the About Pain Management video. Back that up for a second. Go ahead and start playing that video. I'm going to go ahead and skip ahead. So as the patient is watching the video, the progress of watching the video is they report it back to GetWellNetwork's server. And most importantly, completion of the video is getting documented back to GetWellNetwork and back through any bidirectional orders interface and results interface that may be pre-existing. So now if I go back to the patient record and refresh the screen, we can see that the outstanding About Pain Management order has been completed, just as though the patient had watched it in a normal GetWellNetwork bed on a television. And any orders interfaces, results interfaces for this video would be utilized to send that documentation back to the EMR where the order originated from. We just happen, in this case, to order it through the management console. But all existing interfaces can be leveraged in this manner and without any additional integration work. If it works with an inpatient bed installation, it'll work for iPads as well. Alrighty.
Thank you, Mike. And just because I know we get a lot of questions about this every time we talk about it, I do want to reiterate what Mike just said, that we ordered our education today from Management Console because we don't have an EMR here at GetWellNetwork, but that orders and results interface in the medication interface will work with your EMR today exactly the same way as they work in your inpatient environment. So if you have those enabled today, they can now work on the mobile tablet as well as they work in a bed. The last thing about this mobile integration that we wanted to talk about is the inpatient mobile discharge process. I do want to emphasize that the workflow to both check a patient into the iPad and remove a patient from the iPad are manual processes that require a clinician touch. So patients must be manually checked into the devices by a clinician who can prove that they know that patient, put in the name, birth date, and then they also need to be checked out of the iPad. 1 second here, I think my screen share is not actually showing. All right. Great, I apologize about that. So here, now you should be seeing this mobile discharge process screen up here. So you can see this is just a little menu. You swipe to the left and pull up an end visit button here, and then the patient is manually checked out of the iPad. I am saying checked out very consciously because in our guest patients, that end visit button fully discharges patients from Management Console, but this end visit button will not discharge a patient from your EMR if you're in an integrated environment. It simply sanitizes the iPad, like when a patient is transferred from a room. All right. So the next thing we want to go over here is our updated Outcomes Achievement Plan. In addition to creating new features, we know we need to keep a constant focus on how these features are affecting patient satisfaction and clinical outcomes. For that reason, this release represents some changes to the Outcomes Achievement Plan to make it easier for clients and for GetWellNetwork personnel alike to capture how clinical outcomes are changing over time. The updated OAP allows clinicians and GetWellNetwork staff to easily enter up to 18 months of data at a time for any focus area. Instead of being constrained to a year-over-year view, the Outcomes Achievement Plan now allows clinicians and staff to easily compare data as it comes in. You can see that instead of having one field for prior year data and current year data, you now have a field for every month or every quarter, depending on how you track data, that you have data you'd like to enter into the OAP. Our next enhancement won't be a surprise to any IT security personnel we have on the line. As any of you who follow IT news know, many of the major hardware and software providers in the field today, both in healthcare IT and outside, are phasing out their support of Adobe Flash. While Flash was once the standard for delivering dynamic, attractive content, the product has not kept up with modern security standards, and it is no longer a platform we want to endorse at GetWellNetwork. Following the release of PLC 331, a forthcoming PLC software release, which we're actually not covering on today's call, GetWellNetwork is deprecating our support of Flash-based applications. Along with posing a potential security risk, Flash is the source of a high volume of PLC reboot tickets called into our help desk. Now, in order to make this transition easier for hospitals so clients don't have to worry about which content on their system uses Flash and which doesn't, what they're changing, what's staying the same, this release of PLS 5.3 replaces some of our most highly utilized Flash-based features with features that rely on HTML5, namely our games and our pharmacy and mammography prompts. Now, just a note here, we recognize that clients may be using custom Flash content, and our content configuration team will work with ICCs, CSMs, and IPC managers to ensure that all of this content is identified and hospitals can come up with a plan with how to replace it with newer and more stable content. The content configuration team has actually already pulled a list of all of this content that we can see today on the system and identified a lot of it as defunct content that hospitals are not using today, but still have on their system in a deactivated state. The first feature that we're going to go over, the updated games, are 38 new games that not only address our Flash-based concerns, but actually also have two other distinct benefits. These games, these HTML5-based games, unlike the Flash games, are hosted locally within GetWellNetwork. That meaning instead of sending patients out to a web page when they click on a game icon, which is how all the games work in your environments today, the game is housed directly within our system and our servers. So there's a more seamless experience for patients when they're clicking on a game. That also means that game providers cannot change any gameplay or content without notifying us first and providing us an updated file that then goes through our quality assurance and content testing. This allows for a lot more content stability and quality assurance. And lastly, these games will now be available on our iPad delivery methods, so ambulatory and inpatient mobile. Apple has long refused to support Adobe Flash, so moving away from Flash-based games opens up all of our mobile devices to this feature. Our updated pharmacy and mammography prompts provide a sleek, updated look and feel to these high-value features. A significant number of our clients use pharmacy delivery prompts and mammography prompts to help drive ROI, both by preventing readmissions for patients who didn't go home with the correct medications and by keeping revenue within the hospital system. For clients using customized versions of either of these prompts, your ICC, CSM, or IPC manager can coordinate with a content configuration team as part of your upgrade to ensure that you have a plan in place for upgrading your content to meet your needs. This has also been added to the PLS 5.3 upgrade checklist, so you can't miss it when you're going through your upgrade process. Lastly, I want to talk about prescribing MyGetWellNetwork transition of care pathways. So MyGetWellNetwork, which is the portion of GetWellNetwork that lives within patient portals that can be accessed at home after patients leave the hospital, has what we call transition of care pathways. And these MyGetWellNetwork transition of care pathways represent a huge step forward in GetWellNetwork's ability to provide engagement across the care continuum. These pathways use the power of the trans-theoretical model of change, combined with MyGetWellNetwork's location in the patient portal to help drive patients to stay engaged with their health care even after they leave the hospital. PLS 5.3 represents a full integration of these pathways across the care continuum by making their prescription triggerable by any inpatient event. So prior to PLS 5.3, if a hospital, because these transition of care pathways were in beta, if a hospital wanted to order them, they needed to order them directly from the management console. As we know, the management console is not part of the average clinician's workflow if that hospital is already an integrated care environment. Today, after the upgrade to PLS 5.3, any event which can trigger an order today, whether that be an order in management console, an order in the EMR, or placing any other kind of order like for a video, a medication, or a different pathway, can be configured to prescribe these pathways for patients so their education is waiting for them when they're discharged from the hospital. This enhancement opens up an entire world of possibilities for integrating transition of care pathways into existing clinician workflows seamlessly and effectively so that education follows patients even after they leave your care setting, your hospital or your doctor's office. All right, and that concludes our presentation. So I'd like to open up the floor for Q&A. Again, please use the chat feature on your webinar, and we'll address as many questions as we can in the time remaining. So I'm seeing a note from Sean that it looks like we've already had a couple chatted in here.
Yeah, we have a few that have come in already. So the first question is, do I have to log into Management Console with the iPad integrated check-in?
No, it's not necessary. We use Management Console for demo purposes today, but if you have a fully integrated GetWellNetwork system in your hospital using ADT, once GetWellNetwork is aware of a patient because of an ADT message, then that patient is eligible for being checked into an iPad, and it's not necessary to go to the Management Console at all.
Great, thanks.
So another one is an integrations project necessary for the iPad integrated check-in?
No, it leverages all existing integrations. So if you already have a medication order integration or an order and result integration, all that can be used by patients in iPads just the same as if they were in a footwall or all-in-one bed.
Okay, and the next one is, does it work with other tablets besides the iPad?
Not currently. Currently, iPad is the only supported platform, although we are exploring an Android version. But that's not been scheduled just yet.
The next one is, how can I get more information about the video conferencing feature? Is more equipment needed, and what are the costs, and can you send that to me, please?
Yeah, so working with either your CSM or your ICC, whoever you have more contact with, there's no additional fee from GetWellNetwork, but it is required that you have a video conferencing license from the video conferencing vendor Video, which is VIDYO, and your CSM can help you pull all of that together. You also do have to have the equipment in the room to video conference. So if you're not using an all-in-one or a smart TV with a camera and a microphone embedded in it, you'll also need a compatible camera and microphone, and those can obviously vary in cost depending on your hospital and your setup and what's appropriate for your rooms and your patients. And if you send us that question as well in your Marbella survey at the end with your contact information, we can make sure that we reach out to your CSM and get all that information coordinated for you as well.
Great. The last question that we have for now is, will the recording of this webinar be available afterwards? I mean, I can answer that one. Yeah, we'll post the recording of the webinar on Get Connected Online. If you click the Share tab at the top, and then there's a Webinars section in the drop-down. We'll post it right there, so anybody that maybe wasn't able to attend or would like a refresher on what they've heard today can access that through our online community, Get Connected Online.
Great. Thank you, Sean. All right. Are there any other questions? We can give everybody just a minute to type in, but it looks like we've wrapped up, and we want to be respectful of your time. Thank you so much for joining us today. We've come to the conclusion of today's webinar. So thank you for taking the time out of your busy day to learn about GetWellNetwork's newest product innovation. After this webinar, please take a moment to complete the short survey that will be sent to you. It helps us better understand the effectiveness of these sessions and if any additional information is needed. You can submit questions regarding the information presented in this webinar or any questions you have in general related to GetWell Network product innovation through that survey as well. Just remember to put your name in the survey if you are submitting a question so that we can follow up with you directly. I also want to mention that you can learn more about GetWell Network solutions and community by attending Get Connected 2016, our annual user conference, which will be held in Philadelphia in just a month on May 23rd through the 25th. This conference brings together hundreds of members of the IPC community to share strategies and celebrate successes for leveraging patient-centered technology and elevating the quality of care and organizational performance. And with that, we are happy to give you 20 minutes back in your afternoon, and thank you for joining us.